Beginning tomorrow, it is very possible you'll see more people wearing face coverings. Not only does a new directive go into effect in King County, but new rules will also affect how you move about as well. KOMO's Cole Miller live with more on where you'll be asked to put one of those coverings on. Cole?
Well, Steve, good afternoon. To this day, this whole idea of wearing a face covering remains a fairly polarizing topic. With that directive here in King County, there will not be penalties if you choose not to wear one. However, to our north in San Juan County, the council there recently passed an ordinance mandating they be worn. Life as we know it has changed in a big way, and one of the most visible signs of the times, those face coverings and masks you're seeing out on the streets. Starting tomorrow in King County, health officials are strongly urging you wear one if you head out to a public place or store. The same goes for anyone who might use metro buses as a means of getting around.
This directive should be used to educate, encourage, and persuade individuals to wear face coverings.
With that in mind, it will not be enforceable, although it will be up to businesses to decide if you can come in without one. If you have travel plans out of SeaTac, you'll be required to have a covering and use it at the airport. We heard mixed reaction there last week.
It's harmless to wear a face mask.
Everybody should be doing this, taking heed to it for sure.
I think it's stupid. I have no fear over it.
Also tomorrow, if you use Uber, you'll need to have one.
You never know who's getting in your car. As far as I know, we can cancel on either side, either the driver or the passenger, with the reason being health, safety, or something like that. There should be an option within the app.
And in San Juan County, where as of Friday there were just 15 confirmed cases of COVID-19, a recent vote now mandates people wear them there. The health officer citing the age of the population and the draw of summer crowds.
We need to be certain that these people who could be harboring coronavirus have the kind of tools like masks that will help prevent them from spreading it unchecked in our community.
This recent shipment of swabs from the federal government causing some confusion and some concern. KOMO's Cole Miller joins us now live with this developing story. Cole, we have to ask you, what are the issues with these swabs?
Yeah, Michelle, that's a good question. I'm told that the confusion comes down to the packaging itself. Normally, we would see those swabs come individually wrapped, but with this latest shipment, they came in boxes all bundled together. And now the state has to figure out if they can even be used.
We have a desperate need to increase our testing capability.
In the fight to clamp down on the novel coronavirus, that testing has and continues to play a critical role. So far, more than 280,000 tests have been carried out in Washington, with 6.5% coming back positive. And tonight, confusion over this. Nearly 22,000 swabs in bulk packaging recently sent to the state from the feds. Governor Jay Inslee's senior advisor saying it raises concern. Those swabs usually come individually wrapped. These will now have to be tested by state public health labs to make sure they're good to go. Also, the packaging itself raising some eyebrows with that text, "Comforts for Baby," on the label. U.S. Cotton LLC, the manufacturer of those swabs, says in this letter they are appropriate for COVID-19 testing. It's just the latest bump in the testing road. Governor Jay Inslee elaborating in an interview with CNN on Friday.
When we were promised our May delivery for test swabs, we've only got 10% of them.
According to the governor's office, the state is still 230,000 swabs short for the month of May, and that throughout this process there has been conflicting updates about how many will arrive and when.
We are experiencing these failures of the federal government to help the states on this testing. And so if the reason for that is not having enough commitment to getting this job done, that would be injurious.
Well, how do you feel about wearing masks? Have you shamed anyone who wasn't wearing one? Have you been shamed yourself? If so, you've been caught up in a phenomenon that some call pandemic shaming. K2's Lincoln Graves is live for us now. And Lincoln, does shaming actually work if you're trying to persuade people?
Well, Deb, I spoke to several psychologists and sociologists today. They say occasionally it might be effective, but not usually. When it comes to masks, they're not the only thing that pops up when you talk about shaming, but they have become a flashpoint in our current health crisis.
The pandemic has thrown all of us for a loop. In just a few months, our daily lives have been radically altered. There may be no bigger example of the chaos than the wearing of masks.
I think it's so important for Oregonians to wear face coverings.
It's a flashpoint now. Some wear them all the time, some not at all. And everyone has an opinion on what everyone else should be doing. Regardless of what you believe, psychologists we spoke to say shaming is generally the wrong move.
Is that shame oftentimes doesn't have the same results as we want it to.
So psychologically, we wouldn't encourage that kind of way of interacting with people.
Much of that advice is based on how you know the person you're trying to persuade, according to Dr. Roseanne Fish-Getchell, a clinical psychologist with Providence Health Services.
As far as persuasion goes, we have to have a relationship and some kind of foundation of trust with a person.
Meaning sniping at strangers won't help. Dr. Linnea Lindsay, behavioral health director at Legacy Health, also suggests approaching people in a different way if you're determined to engage.
Well, the same way that you might approach somebody if you were concerned about they didn't have a jacket, or they might be cold, or if we're concerned about them, that's a different approach than to approach them with the kind of concept of, why don't you have a jacket?
Well, a sign of COVID times. Take a look at this. A line of cars in Fremont today, where since early this morning, this has been happening. Dentists have been lining up to pick up protective face masks. Here's why. Many of them officially reopened their offices Monday, and some worry there just isn't enough personal protection equipment. They tell KOMO's Suzanne Fawn they consider the need critical right now. She joins us live with more on that. Suzanne.
Well, it was a pretty remarkable effort here today. Things wrapped up about an hour ago. Organizers tell me they handed out 280,000 free surgical face masks to dentists today. Those masks, they say, are critical to keep everyone safe.
We got 2.
All the way up front.
Thank you.
It was nonstop on this Saturday.
We've been here just all getting them out as fast as we can.
Dentist after dentist driving by for critical supplies.
Each dentist gets one bag with 25 KN95s and 25 class 3 or level 3 surgical masks.
Orthodontist Randy Ogata helped hand out PPE to dentists.
They need it very badly. There's a lot of dentists that don't have any PPE.
We are distributing free masks for dentists licensed in the state of Washington to help replace the stock that many dentists donated to healthcare facilities back when the COVID crisis started.
The Washington State Dental Association and Delta Dental of Washington secured 300,000 masks from the State Emergency Management Division. Saturday's distribution drive was for dentists in Seattle, King County, and Snohomish County. Dr. Dominic Corrali with Smile Ballard says he truly appreciates the supplies.
We've tried really hard to find these masks on our own, and they're very hard to source right now, and they're really expensive too.
Like many dentists, Corrali made changes to his office to protect his staff and patients. He's preparing to officially reopen on Monday. We checked with the Washington Dental Hygienists Association and asked them what concerns them the most about the COVID-19 crisis.
We know that this virus is spread through that, the droplets and the splatter, and because we're working in such close proximity to the mouth where all of those droplets and spray comes from.
These masks give us protection for not only the dentist, but our staff.
So it's safe for the patients to come back. It's safe for my staff to work on the patients.